Good morning. We, the scientific committee, decided to have a session where the youngsters could be given some advice, insights, and tips from world leaders of orthopedic associations as to what instances, what reasons contributed to their path in their professional careers and how they reached the pinnacle at which they did reach. So we invited and requested the president of 5 associations to tell you about their leadership qualities, and the scientific committee sent them 5 questions and requested them to answer those 5 questions as a PowerPoint presentation. So the first speaker in this session would be the president of the American Academy of Orthopedic Surgeons, Dr. Kevin Bozich. It's over to you, Kevin.
Well, thank you, Jamal. And first of all, I have to say that's a very tough act to follow. We just learned a lot from the last speaker, and now Jamal put us in this position to have to top that, which is very difficult. But I will say I appreciate Jamal giving us this opportunity. I look forward to learning from my peers and colleagues. This is a topic that I'm passionate about and think a lot about. And I will say I don't have all the answers, and I'm a lifelong student in this area. So he asked us to talk about 5 things. First of all was leadership. And the first thing I'll say about leadership is that it's something that you have to work at. I don't believe that leadership is an innate skill. I believe it's a learned skill. And I have a leadership coach that I've worked with for 16 years. I meet every week for 1 to 2 hours with my leadership coach. I have homework assignments, and I'm continuously working on my leadership. As Peter Drucker, the business consultant, once said, knowledge has to be improved, challenged, increased constantly, or it vanishes. So don't assume when you get to a certain position in life that you've mastered leadership and that's where it ends. The other thing, this is one of my favorite quotes about leadership from the Chinese philosopher Lao Tzu. A leader is best when people barely know he exists. When his work is done, his aim fulfilled, they will say, "We did it ourselves." And this is really the philosophy behind servant leadership. I believe that leadership is about servant leadership. It took me a long time to learn this, but the further along you get in your career and you become responsible for other people's careers, our success is their success. It's no longer about the accolades and awards and titles that I get, but it's about the people that I am privileged to serve and lead. And so I really believe in the concept of servant leadership. The last thing I'll say about leadership that I learned, again, the hard way, this is an excellent article from Harvard Business Review about why efficient leaders fail. And I am a highly efficient person, and I am a very task-oriented person, and I had to learn that relationships are more important than task. And so this is a great quote from the article. Highly efficient leaders lose their focus on people due to a limiting belief that more people-focused activities will slow them down and impede their ability to execute and ultimately to be successful. So I could leave this hall and start working on my next talk and focus on myself, or I could spend time getting to know my peers and colleagues. And I believe that this is a fallacy that a lot of leaders have, that it's the harder we work and the more tasks we accomplish which are going to get us ahead. And as this article points out, the irony is that an intense focus on efficiency and getting things done makes leaders less effective overall. The next topic he asked us to talk about is mentorship, and I've been fortunate to have many mentors, both within the field of orthopedics and outside. This was one of my first mentors, David Bradford, who taught me don't take yourself too seriously, and he reminded me that the success and the accolades we get when we're in this profession are very fleeting. And 10 years after we finish our careers, very few of us will be remembered or talked about, but our families will be the ones that remember us. Jim Herndon was a mentor of mine who taught me to think outside the box, and he was the one that encouraged me to get a business degree and learn about more than just healthcare and orthopedics. Aaron Rosenberg was my fellowship mentor, and he's the one that taught me the importance of creating personal goals. So a brief story about Aaron: when I started my fellowship, he asked me to meet him for breakfast one morning and to bring my goals with me. And so I brought my goals, and they were all about how many cases I wanted to do and how many publications I wanted to have and what kind of job I wanted to get. And he looked at me and he said, "Kevin, how old are you?" And I said, "I'm 36, Aaron." He said, "Do you want to get married?" And I said, "Well, I think so." And he said, "Do you want to have a family?" And I said, "I think so." And he said, "This is nonsense." And he took my goals and he ripped them up and threw them back in my face. And he said, "Come back here in 1 week and let's talk about your goals." And no joke, a week later, he introduced me to my wife. And so he had a big influence on my life. Dan Barry, who many of you know, is really taught me the importance of servant leadership and how to be a role model as a leader. And then Joe Ionati, again, someone who is a very selfless leader who really looked out for me in periods of my life when he had offered me a job, I didn't accept the job, and he still followed my career and helped me long beyond that and left a mark on me. And then Michael Porter, the Harvard Business School economist, was my professor in business school who taught me a great deal about concepts related to value in healthcare. And all of these mentors shared these characteristics. They were good listeners, they were knowledgeable, they were non-judgmental, which I think is a very important part of being a leader, honest and candid, able to network and find resources, and finally willing and able to devote time to developing others. Next topic that he asked us to talk about is work-life balance, and I read this book, Essentialism, which my colleague Bill Levine from Columbia shared with me, and it talks about the discipline that you have to apply each and every time you're faced with a decision about whether to say yes or whether to politely decline. And what I learned the hard way is, if you don't prioritize your life, someone else will. And so it's important that you determine what is insignificant and what is essential and do away with the non-essential activities and commitments. This book taught me that the word priority is derived from the Greek stem, which means one. You can only actually have one priority. The concepts of priorities is a fallacy. And this was another book by Elon Musk. I don't know what you think about Elon. He's from where I live in Austin. I'm not a huge fan of him, but he has an algorithm that he applies to every decision he makes. That includes question every requirement, delete any part or process you can, simplify and optimize, accelerate cycle time, and automate. And I think those are good lessons to learn. My approach to work-life balance, again, personally, I work with an executive leadership coach. I evaluate every request against my goals and priorities, and I've learned that if it's not a clear yes, then it's a clear no. In other words, if you have your top 10 goals and it's number 11 is the same as number 200, and you have to apply that level of discipline. I've learned to compartmentalize so that when I'm focusing on my clinical practice, that's what I do. I don't have meetings. I don't do academic work or administrative work when I'm in my clinical time. And similarly, in my personal life, I shut off my phone. I focus on my family because I realized I learned a long time ago, my family and my children are not impressed that I'm an orthopedic surgeon and I'm the president of the AAOS. They want me home for dinner, they want me to be there on the weekends, and that's what's important to them. And I have weekly date nights with my wife, Christy, who's here with me, and a weekly date with my daughters, and we have family supper every Sunday night. Last couple slides, regrets. I have a few. Not taking up golf earlier in life. My father tried to get me to play golf when I was a young boy, and I said, "Dad, that's a sissy sport. I'm going to play football and basketball and baseball," and unfortunately now my golf game has suffered because of that. Not spending more time with my middle daughter as she transitioned to adolescence. I have 3 daughters, and our middle daughter struggles with mental health issues, anxiety, depression, substance use. And I wish that I had really been around more when she was transitioning to adolescence, to be there for her during those times that were very challenging for her and our family. And then finally, I wish I had learned another language. I was talking to someone here yesterday who said most Indians learn at least 4 languages, and I've never learned another language, and I struggle with language. So I'm leave you with my personal advice, again, which is from my own personal experience. It's not the right answer. It's just what I've learned. I think it's important that you set goals and priorities and hold yourself accountable. No one is accountable for you missing your goals and priorities other than yourself, and stop blaming your failures on other people. Don't let perfect be the enemy of good. Someone taught me the 80-20 rule. I remember long ago I was interviewing and negotiating for a job, and I was told to get everything in writing ahead of time. And when I finally ended up having the job withdrawn, the person said to me, "Kevin, get 80% of what you think you need and let the other 20% come." And that was a hard lesson for me. Again, the importance of focus. You have to cultivate selective ignorance, and as was said in the prior talk, ignore all the distractions. The world is set up to distract us constantly, and you have to have focus. And again, don't take yourself too seriously. As I learned from David Bradford, we are all replaceable other than to our family. And so again, thank you very much. I'll finish with this quote: "Success is a journey, not a destination, and the doing is often more important than the outcome." I think far too often we think about getting to that peak of the mountain instead of enjoying the ride. Thank you very much.
Thank you, Kevin. That was really brilliant and from the heart, from personal experience. And now I would call Dr. Michael Johnson, President of the Australian Orthopedic Association, to answer the same 5 questions.
I'd like to thank Jamal for inviting us. We've had a wonderful time. And for Dr. Sekaran, that was the most wonderful talk that you gave before. So thank you. Leadership and first, my conflicts of interest. I do have some shares in an orthopaedic implant company, and as a principal investigator of the Australian Spine Registry, I've got sponsorships from multiple organisations. We were told to think of one thing that's made us a better leader, but I couldn't get it down to one, and I've thought of 3. If you look at great leaders, they've all had a very clear purpose and vision, and an ability to inspire the group with purpose and vision. So Gandhi had this belief in freeing the Indian nation from British colonialism. Mandela, freeing South Africa from the horrors of apartheid. Martin Luther King believed that all people were equal. And Bill Gates and Steve Jobs believed that computers weren't just something for businesses, they were a tool that could be used by the whole community. So an organisation needs extreme clarity of purpose, and that's the first part that an organisation needs to identify. And the leader needs to believe in that purpose. And if the leader doesn't believe in the purpose, they either quit the organisation or they change the purpose of the organisation. The purpose needs to be a long-term purpose, and preferably for the greater good. Ambiguity of purpose leads to ambiguity of decision-making, whereas clarity of purpose leads to consistency of decision-making. This leads to trust, respect, and ultimately influence. Number 2. Oh, I missed one. About 10 years ago, the Australian Orthopaedic Association examined its purpose. And we came up with a purpose that the organisation was to restore the wonder of movement. This is very much focused on patients and access of patients to orthopaedic care. It's not about surgeons, although the surgeons are inevitable beneficiaries of this process. So if you look at training and education, you need a workforce that matches community needs. If you look at culture, diversity, equity, inclusion, you need an organisation and a workforce that becomes something that the community can identify with. It can't just be a whole lot of males. Community clinical practice and research in our organisation has been almost instrumental in the world of setting up registries and advocacy engagement, and you'll only be successful with advocacy engagement if it is patient-focused. Number 2, the leader is not necessarily a good implementer. But the leader does have a responsibility to make sure that the organisation has a very robust governance system of delegations, reporting, oversight, strategy, risk management, etc. Leaders generally do not provide the output of the organisation, but the leader must facilitate and provide the resources for the members of the organisation to maximise their potential. And the other thing, it is essential that the leaders provide a safe environment and a strong culture where everybody is included. If I look at my orthopaedic mentors, I was thinking back of all my mentors, who do I actually aspire to? And I divided them into personal mentors and surgical mentors. And the person I most aspire to is, even though he's an orthopaedic surgeon, he's not on the list because of he's an orthopaedic surgeon. I aspire because of his personal qualities. It's a man called Jonathan Rush. He's an orthopaedic surgeon at St Vincent's Hospital in Melbourne. He's a very skilled surgeon, but his qualities that I admire have been his integrity, honesty, empathy, and his ability to treat everyone with kindness and respect. If I look at my surgical mentors, there are too many to name. And I think that we all need to think of ourselves as mentors. We all have something to teach each other, and we all need to be prepared to learn things from each other. Work-life balance. This is an impossible topic because as part of being an orthopaedic surgeon, we have a contract with patients to treat them with complete devotion. And so orthopaedics is an extremely demanding career with on-call, complications, hospital follow-ups. It does put enormous pressure on work-life balance, families, etc. I think it's essential that you have a group of colleagues who you can trust and share the load so that when personal obligations are coming up, there is somebody who can assist you and allow you to take part in those more important personal obligations. You need to plan your holidays well in advance. You've got to remember you can't go on holidays when you're dead, and I think that's something people forget too often. Don't miss important family events. They'll never happen again. And your children grow up very quickly, so enjoy them. And here's just a few pictures of our kids. Regrets. I actually don't have many regrets. I've had a wonderful career and I feel very lucky. I do have regrets about individual patients, and sometimes I haven't been able to put them behind as we're advised that we need to do. But when you do have regrets, it's important that you learn from your regrets. So when I'm teaching the fellows, almost every move or every procedure, I can tell them, well, you don't do that, because I can almost name the patients where there's been a problem with that particular manoeuvre of the operation. I think it's one of my other regrets is not combining my home and work calendar. Advice. I think it's essential that we're all humble. We should all be prepared to ask for help and to help others. We all have failures and frailties, and a strong collegiate friendship group is an enormous asset. Remember that we're part of a team, and it's not us that succeed, but it's the team that succeeds. Thank you.
Thank you, Dr. Johnson. We now have one of our leaders, young leader I should say, Dr. Parag Sancheti, as the President of the Asia Pacific Knee Society. We have to see what he says on the Indian context.
Thank you very much, Dr. Rajshekharan. And on the outset, let me thank Dr. Jamal and his entire team for having given me this opportunity to be a part of this powerful session on leadership, where I'm going to try and speak to you about leading with purpose and passion. So the same 5 questions all of us will be answering. Leadership. What has made you a better leader? And well, I think leadership is all about taking decisions. When you're at the helm of things, people will come to you, your staff will come to you, your subordinates, your employees, your associates, and they will ask you for decisions. So you have to take the decision there and then. And mind you, not every decision will be a right decision. So how do you know how to take the right decision? Well, the right decisions come with experience. And how do you get experience? Experience comes from wrong decisions and bad decisions. So I think it's important to take those decisions, and if they don't work, they don't work. So be it. You've got to live with it, and you've got to then modify and change your stance because you took that decision. But the most important thing, as was alluded by the previous speaker, Dr. Michael, is that you have to be accountable and responsible for that decision. The second quality is your ability and your courage to take risks. Unless you take risks, you're not going to achieve anything. You're going to achieve only that much you take the risk. Because unless you take risks, nothing is going to really happen. And you've got to have that courage. There's a very thin line dividing bravery and stupidity. So if you're successful, people will call you, oh, such a brave, courageous person. But if you're not, then they're going to say, oh, what a stupid decision. But well, then you've got to live with it, because there's always going to be failure. You have to take risks. You've got to come back again if you fall. Every time you fall, you've got to rise. So it's all about taking the risks. And the third thing, which was again spoken earlier on by Guruva Reddy, he gave a full lecture on, building teams. So I think it's very critical to make a good team. You have to handpick your team. You've got to trust your team, and more importantly, the team has to trust you. You've got to translate to them on a regular basis, on an incremental basis, day to day, what is your vision? Where do you want to go? So only then the team will know. If the leader doesn't have a vision, his team cannot perform. So I think team is something which is very, very important. Mentors. Everybody has to have a mentor, and without a mentor, you can't really have success. So my dad is my first mentor. I always grew up, adoring him, though he didn't give us much time, but he is the one who taught me so many qualities: honesty, integrity, the ability to work hard, and the attention to details. He will, wherever he goes, he used to see things in detail. And his tenacity and perseverance, I think that was something which is a fantastic quality. His patience. Even if he doesn't achieve something, he'll work on it again, and again. I still remember times when he used to come at 2:30 in the morning, get up at 4:30, do his yoga, and 6 o'clock he's back in the hospital. That was his ability to work hard. Another thing which I have always learned from him, his motto, serving patients is serving God, and how to win a patient. There was this one patient, I remember, a lady who came and said, doctor, I want to become all right in 3 weeks. So my father asked her promptly, why in 3 weeks? She said, my daughter has come and she is going to deliver soon. So I need to be in fit health to take care of my daughter and the child which is going to be born to my daughter. So my father assured her, he gave all the treatment. And then after 3 months when she came back, as soon as she entered the room, the first question he asked her, was it a son or was it a daughter? That patient was aghast that how could 3 months later such a busy doctor remember? So that's the connect which he made to the patient. And apart from having fantastic knowledge, fantastic, experience giving good medicines, it's important to have that wavelength, that connect with the patient. That is something which I learned from my father. My second mentor, Dr. Ranawat, and he's a mentor who's been through me inside the OT and also my philosophical guru. He's the one who taught me so many surgeries. Whenever I used to have a complication, I used to pick up the phone, call him, and he always had a good answer which would help me to sleep better at night. One of the things he said was, do less but do it good. That is so important. We try to take up so many things, but then if you do less and do it good, then you can do more things as time goes by. And one thing he said, good things in life will always prevail and bad things will perish. So there is no shortcut to success. You've got to do good things. You've got to be at it, and only good things in life will prevail. Bad things will perish. So once I asked him, whenever we do a bilateral knee replacement, the patients come and say that my one knee is better and the second knee is paining so much that why does this happen? How to answer this? And he gave me a very nice answer. What he told me is, you should tell them that both the knees are like twins. One, and the twins, even though they look alike, they always behave alike. So that's the same thing in the knees. So whenever I have a bilateral patient and he says that, doc, my one knee is so good, the other is not doing so good, you didn't operate properly on the other knee, then this is the example I give them and I get away. Along with an orthopedic mentor, I think we need a spiritual mentor. And for me, that spiritual mentor is Sister B.K. Shivani. She taught me that life is not a competition. Each one of us are here on a journey, and we have to make our choices depending on our capacity, our values of life, and the principles we have. She also taught me life is a manifestation of your thoughts. What you think, you become. Sankalp se siddhi, sankalp se srushti. Your thoughts will become your destiny. So that is something which is a very powerful thing Sister Shivani has taught me. Work-life balance, indeed an important thing. And we've always been made to think that work is not good and life is good. But I feel it's a balance. And as you can see in this slide, I think work to me is more important, because if you see this quote, this is the essence of my work-life balance. You will never feel truly satisfied by life until you are satisfied at work. So I think first important thing is to be satisfied at work. If you're satisfied at work, you will be satisfied in life. Take that from me. And if you're satisfied in life, it doesn't become the other way. Then you become happy at work. I think work is important. And these are the 5 baskets I have. And Dr. Raja also showed one slide where, in what all do you want to achieve? Of course, your professional work, your academic research, like I'm here for a conference, family, hobbies, leisure, friends I put into me time, and health, which is mental health as well as, physical health. So all these have a percentage, and these are the percentage I have put. And on one day, you cannot do all. You've got to prioritize. I think that is something important. You only have 24 hours in a day, and even our Prime Minister has 24 hours. It's all about giving 100% commitment to what you're doing. I'm at a meeting here, so my 100% time is going into academics, research, and some time in meeting friends. So it's a combination of 2. So each day you will have to divide. And I think that is what you've got to plan. And I do that on a Sunday evening, how my week is going to go. And every day you cannot do those 5 things. You've got to do 2 or 3 things out of these 5 things, and then give it 100% commitment. That is important. Regrets, of course. I also have regrets. The first regret is that, I have never been able to cultivate a hobby. And yesterday when I saw this child play the flute so well, most of you were there for the dinner, I think that has rekindled in me that I can still do it. Because I think having some art, some creativity is therapeutic. And I can give you an example. Dr. Rajshekharan's father started his first hospital at the age of 51, 10-bedded, 2 OTs. And at the age of 60, it was 50-bedded, 8 OTs. At the age of 75, Dr. Rajshekharan's father did a PhD. And then he was the oldest person to get a PhD. So, you should not have regrets. Life is, still there for you, and you can still go back and do it. And I'm going to learn the flute. Of course, not spending enough time with family. That's always there. But one thing what has changed, when I was a kid, I used to say, oh, my father never spent time with me. But now that I don't spend time with my children, I have stopped saying that. And I never complain that my father never spent time with me. So that's something which has changed. The advice which I would like to give IDK, and it's not I don't know, it's integrity, dedication, and knowledge. Nobody can doubt integrity and honesty. You have to have it. You have to have the dedication. Nobody dies of hard work. You've got to work hard. There has to be that passion in you. And please remember, nothing happens overnight. You've got to work hard for it. You have to have a goal. You have to have the domain knowledge. Unless you have the domain knowledge, like Chandrayaan, it went on the moon. They had the knowledge. It's not only integrity and hard work. They had the knowledge to put the Chandrayaan on the moon, and they did it. So that's important. You always have to have a goal. Your team should relate with your goal, and then the action will lead to the success. So in summary, friends, leadership, all of us orthopedic surgeons are leaders, and we have to lead from front. we have to lead on various accounts and various fronts. I think as mentors, even though I am a mentor, I am also a mentee. So I think a mentor and a mentee always learn equally from each other. Last but not the least, work-life balance has to be in coexistence. It has to be integrated together. It's not only about work or only about life. It's an ecosystem and both will coexist. And I want to end with this, my favorite quote, I never lose. I either win or learn. I thank you very much for your kind attention.
Thank you, Parag. That was really wonderful. I will now call upon Dr. or Mr. Simon Hawkinson, British Orthopedic Association President. It's amazing how all the presidents tell us different things, but there is a common thread, common philosophy behind everyone's answers.
There is indeed, and I suspect I'll be no different. So Jamal, ladies and gentlemen, thank you for asking me to give you my thoughts on the topic of leadership. So you can see who I am. I apologize for the confusion between Mr. and Doctor. That's an ancient tradition when physicians hated surgeons in the United Kingdom. These are difficult questions, and Jamal asked 5 questions. This is where I come from. That's Portsmouth Harbour on the south coast of the United Kingdom. That's the home of the Royal Navy, which is supposed to be on the right-hand side of that slide, but you'll be hard-pressed to find any ships because we don't have any left. But when I was in the Navy, and that's when I had colour in my hair, we did. And so the first question that Jamal asked was one thing that made me a better leader. Now, it's not one thing, I think it was a system, and that was the military. I spent 21 years in the Royal Navy. What did I learn in the Royal Navy? And I sat there thinking, well, how did it make me a better leader? And I don't suppose at the time I knew that it did make me a better leader, but it taught me an awful lot. And it taught me discipline, and that wasn't just getting shouted at or shouting at people, which is the common interpretation of what people think happens in the military. But it was also respect. It was respect for everybody that was there as part of the team. And again, 40 years ago, these were not terms that we were really familiar with. But I think my mentors, who I'll talk about later, were. Leadership as an officer was expected, but I don't think we really knew what it was. But discipline was definitely there, and whether that was rolling your socks in a particular way, which used to drive me nuts when I was at the Royal Naval College in Dartmouth, or making sure that your bed was made adequately on a ship, you soon realize that these things mattered, because if aspects of your bedding, aspects of your cabin, aspects of your living space ended up blocking drains, blocking water exits on a warship, whether you were in the South Atlantic getting thrown around by waves 60 feet high, or whether you were in a war zone, mattered, because that mattered for everybody on the ship. And you realized that you were just one small cog in a system. Respect was there for everybody. But that varied, of course, between services. And I remember well in the early days realizing that I just wandered around the ship trying to make people better. But everybody else around that ship was making it go forward, occasionally making it fight, but also making it safe for the 250-odd souls that were there. And when you're down in the South Atlantic, and as I said, being bounced around by 60-foot waves, you soon realize that you needed everybody around you. I also realized that actually that respect went from the top to the bottom, whether it was the captain of the ship or the lowest of the low. And of course you may say, well, the lowest of the low was the man with the spanner working on the engine rooms. But on the ship I was on, those were jet engines. Those were Rolls-Royce engines that in another guise made Concorde the world's first supersonic aircraft. So this young man, as it was in those days, was no lowest of the low. He was an expert, and he could manage a jet engine. I also learned that you never asked anybody to do something that you weren't prepared to do yourself. Teamwork, again, wasn't talked about in such a way, but it was there. One of the things that you had to do in the Royal Navy prior to going on a warship was learn how to deal with a problem if it occurred. There was no point in, as they did in a famous TV show, sticking two pencils up your nose and your underpants on your head and shouting "Wibble," because the ship was going to go down and you were going to die. So in Portsmouth, there's a fascinating place called the Damage Control Unit training exercise area, and they have a steel cabin made up like a warship that's full of holes, and it starts filling up rapidly, and you either do something or they won't let you drown. Well, hopefully they won't let you drown. When we all went through Dartmouth and there's a bunch of doctors, I think they all stood and sniggered and thought that we were all a bunch of prima donnas and makey-learny leaders, and we would all drown because we couldn't work as a team. But we could, because what rapidly came apparent as the water was pouring in, and I mean pouring in, and it was freezing cold, was that we all realized we had to accept that some of us had to do a job and somebody would have to be a leader, and rapidly somebody was chosen. And in my case, it happened to be me. Heavens knows why, but it was. And we were one of the fastest teams that they'd ever had go through there that actually stopped the water coming in and effectively stopped the ship sinking. So we could work as a team. Although again, none of us at that stage, I think, knew why. But we soon realized, and there's that famous analogy in the military, that if you don't bring your team with you, and yes, there has to be a team, but there has to be a leader. If you don't bring that team with you, going over the top without your team and turning around to find that you're the only one being shot at, can be very lonely. So that was the military. But of course, sometimes taking military values into civilian life can cause problems, and I've seen it happen. So I had two mentors in my life. One was a naval officer, an orthopedic surgeon when I started my training within the military, a fearsome individual, and I well remember as a junior doctor you had to take the notes of your patient to be signed off by the boss, and they would usually and invariably be dispatched back to me with a deft right hand, usually aimed at my head, and being told to get it right. If you're in the UK at the moment, and I'm quite sure, well, he's made it as far as Australia, Professor Tim Briggs has a project called GIRFT, Get It Right First Time. But my old boss in the Navy was 35 years ahead of his time, because he was insistent that I got it right. And if it wasn't right, it came flying back to me. So I learned then, at a very early age, that trying to get it right first time was absolutely important. But my next mentor, and I won't name him because he's still around, was a delightful chap, arthroplasty surgeon in Portsmouth. And what this man could do was listen, and he could listen to all sides of the argument. He would never pass judgment. His door was always open, and he was always there if you wanted to talk to him. It didn't matter whether you wanted to talk to him about what you did the night before or whether you had a problem. He was always there. And I learned, I think, from him that being available to people who you are in command of or looking after was a valuable tool. And when I was a program director and ran the training program in Wessex on the south coast of England for 8 years, I made it my mission to have my phone turned on all the time. And that could be in the middle of the night, and it could be all day Sunday, as it happened on one occasion. Because when somebody needs help as a colleague, you have to be there. The third question was work-life balance. We've heard a lot about this, and I think there's a theme, as you referred to, that's coming through with a lot of these talks, and maybe the gentlemen in this room need to pay attention. My wife will say I don't have one. I do have an interest. It's an ancient old motor car called an MG. It's a 1973 car, which occasionally runs, usually doesn't, and is costing a fortune. One day I'll try and get it to run better. But you do need another interest. You do have to have a distraction. And I think one of the distractions, even if you can never think of something else to do, and we've heard about golf and sports and all other things, is your family. So when it comes to regrets, and we've heard this before, and I admire the bravery of my American colleague, is your family. When I was younger, my daughter was 7, and she went to the local school, a new school, and she was asked to write an essay. And she wrote an essay with a certain title. And I came home that evening, was sitting at the table, having a cup of tea, reading the newspaper, and the phone rang, and my wife answered it. And after much silence, I realized I was in trouble, because that had been the school's pastoral office that had phoned up to make sure that she and her family were well, because they thought that I was either dead or gone. Because the title of my daughter's essay was what would she most want in her life, and that was, her title was To See My Daddy, because I was never there. Clinically, I do have one regret, and that's research. I never did enough. I wish I had done. It's not that I wasn't interested. I don't think there was much focus in my youth, and I'm constantly amazed and astonished by the young people that I see today, and certainly in this meeting today, it's to be applauded. I would also say that one piece of advice and one regret that I have never taken that advice is to say no. I'm not quite as structured as my American colleague. I wish I was, because I don't say no, and I tend to regret it. What would I give in terms of advice to the young, as if it's my role to give advice, but the question was put, so I'll answer it. I would just say three things. We are all fallible. Nobody in this room, nobody at this conference, nobody at any conference is perfect. We alluded yesterday to the just culture, and we alluded to the business of a blame culture. It's something that we have been trying for years in the United Kingdom to solve, and we have to solve it to make life better. So no one is perfect. And I would say to all the surgeons in this room today and in this conference who are practicing consultative equivalent surgeons, please never forget that you were once a trainee, and never forget what it feels like to be a trainee, and when you're looking after your trainees, act accordingly. Thank you very much.
Thank you, Dr. Simon. Now we have Dr. Onda from Turkey as the President of the European Federation of past President of the European Federation of National Associations of Orthopedics and Traumatology.
Thank you very much for the kind invitation. As it was told, we were asked 5 questions, and the first one was about leadership, one thing that has made you a better leader. Of course, this is very difficult. It's very difficult to answer this one. When 195 global leaders were asked to rate 74 qualities of leadership, these were the top 10. And you can actually count many features of leadership, and it's very difficult to select one. But for me, my leadership trait is to follow up, persistently and painstakingly follow up, to try not to let any loose ends, to establish a system whereby I can monitor how things are going and check them regularly. The second question was about our orthopedic mentors. Who are they and what important thing did they teach you? Of course, I was so lucky to have many mentors in my profession, but I would like to mention these 4 very important people for me. First one was Professor Dr. Macit Üzel from Istanbul University, where I got my orthopedic training. He was the head of the department when I was a resident and in early years of my career. Unfortunately, we lost him 3 years ago. I learned a lot about general orthopedics and traumatology from him. He had very high surgical standards. I learned being attentive, being detail-oriented. He was a very good surgeon. In any second during he is performing a surgery, you could take a picture and you can print it on a surgical atlas. And the second mentor for me was Professor Nafiz Bilsel, again from my department. Of course, we had more than 10 professors at that time in my department, but Professor Bilsel was also very efficient, very influential in my life. I learned a lot about general orthopedics and traumatology. He was my spine surgery mentor. I learned to be broad-minded. I learned practicality from him and being supportive. The third person I would like to mention is Professor Ensor Transfeld from Minneapolis, from Twin Cities Spine Center. When I was there, of course, I learned a lot about spine surgery. I always admire his positive energy. I learned being calm, humility, and being supportive from him. The last professor is Professor Ünal Kuzgun from Istanbul, not from the same institution with me. I had the opportunity to work with him in different executive committees, societies, or also other committees, and I learned patience. He was very good at delegation. I learned determination from him, strategic thinking, and active listening. The third question was about work-life balance, which is a very difficult question. Of course, as all other speakers, I would like to mention my family, my wife, my daughter. They are so important to me, and I have regrets of not spending enough time with them. Also with the wider family, with the parents and other relatives. And of course, the friends are so important. As Raja mentioned, you should have a good company. It is so important with whom you are at your times of success and times of failure. And as he mentioned, a quote, you are the sum average of the 5 people with whom you spend your time with. I think more than 5. And if I would like to point out only one person who really influenced my life, of course, it is my wife, and she is so tolerable, she's so understanding. She's a dermatology professor, and here you see some beautiful pictures from your beautiful country when I was with her. Here, unfortunately, this time she couldn't come with me. I always needed her understanding, and to have good family and to have good friends help you to have better inner peace, and it will have reflections in your profession, of course. And here, during this conference, I see many good examples of this good life-work balance. This is a picture. Actually, I took permission from Sunakashi and Gunvinder to use these pictures during my talk here. It is very important for this baby to feel the warmth of her father even during a conference, and it is maybe more important than keeping a balance like you see on the right side. And the fourth question was about the regrets. If you could turn back the clock, what part of your professional journey would you like to do differently? Actually, one of my biggest regrets is that I did not pursue diligently to be able to play a musical instrument. You may think that it's not related to my profession, but I don't think so. If I were to have such an ability, and I didn't even look into it, I think I would be able to make use more of my brain in a more coherent way, would be able to associate more things, because I believe that those who play instruments are able to make more use of their brain capacity, which is helpful in your profession, of course. What else would I do differently? I would expose myself more to other professional cultures. I will try to understand how people do things elsewhere in a regional, national, and international level, so that I would have a wider perspective early on in my career. And the last thing was advice. What is that one advice that you would like to give to the young surgeons in this hall? Pick up a specific hobby. I'm not talking about listening to music, liking music, or general reading. Pick up a specific hobby. There are so many venues in life that you can be interested in. Pick up one that you feel yourself really close, and then pursue it. Along the path of your career, you need to go through that way, because this will show you how a discipline is organized other than of your own. You need to immerse yourself in another area of expertise. You can be interested in the history of a specific era, a specific art period, an in-depth analysis of a cultural change, whatever. But you need to immerse yourself in another area of expertise. That will help you a lot in your orthopedic surgery skills, believe me. And realize that everybody has their shortcomings and downsides. Focus on their strengths and virtues. Also make an effort to understand your own abilities as objectively as possible. Find your strengths and be aware of your weaknesses. And always be confident, self-confident, and value the opinions of others. And always make sure that you sleep well, because it is only if you sleep well that you are fresh again. And to sleep well, you need to have a clear conscience. Thank you for your attention.
Thank you, Wanda. We would just have time for 2 quick questions. Anybody from the audience? Yeah, yes, sir. So while they are coming to the mic, can I ask Kevin? Kevin, you spoke about, I mean, all the speakers can come to the stage if you want to. I will have to have a photograph also. Kevin, you mentioned that you benefited from a long-term leadership program. So I know now a lot of leaders are going through a basic MBA in management sciences and leadership. Would you advise that to all our younger surgeons?
So I got a master's in business administration, and that got me more interested in leadership, but I don't think that is for everyone, and I don't think it's necessary. I think that probably the more impactful thing on my leadership journey is having a personal leadership coach who I work with every week and who holds me accountable. And I think all of us can improve as leaders, and so seeking out a coach or someone who can help improve your leadership skills is probably more important to me than getting an advanced degree.
I am
Yeah,
Dr.
please.
K.T. Tripathi. My question to all honorable presidents. So the leadership is outcome of one of the finest democratic process. And all the leaders, when they come to the top of the pyramid, they become too busy, and the same masses are not able to approach them, and it is said that they have become a bit autocratic. How to deal with this situation?
So are you asking from the other side or you're asking from the leader's side?
From the leader side.
I think you are describing someone who's not a good leader. Because I think that for someone to be a leader has to facilitate the group to achieve what they want to achieve. And you can only do that by communicating with the group and receiving feedback from the group. It's impossible, whether you're running an X-ray conference or whether you're running a meeting or whether you're running a huge company, how can you have an idea as to how to improve the output if you're not listening to the people who are producing the output? It's a nonsense.
So, if I understood your question correctly, is that when you become a leader, you become more famous. So I think there are people who always want to come up to you, talk to you, ask you, but because of a limited time, you cannot. But I think it is important that you address what that person wants to ask. So what I do is, I give them my card. I tell them that here's my cell number, here is my email. Write to me or email me or speak to me. And whenever that person does that, then I answer. But if you see, 60 to 70% of people don't write to you. Or they just, want to ask you that question, they never revert. Those 30% who do, I always make it a point to, reply to them or call them and answer their queries. So that's how I deal with less time.
Thank you.
The last
Thank you.
quip at work-life balance and sleep. So how much sleep do you think is necessary per day? So I would ask all the panel members to say. Parag, do you sleep at all?
I would say 6 hours plus minus 2. Each one is wired differently. The minimum you need to sleep is 4. If somebody sleeps more than 8 hours, there's something wrong.
I generally sleep about 8 hours. I go to sleep about 9:30 after reading a book. Usually a book will put me to sleep. I then get up at 5:30 and exercise for an hour, and then get ready and go to work.
Oh, that's long hours. Yeah, good. Yeah, Wanda?
Yeah, actually, I talked about sleep, but it was like promise me, son, not to do the things I've done. Yeah, I think you should sleep at least 6 hours a day, but I'm not sure if we can do it all the time.
As much as I can get.
Yeah, I mean, I think the sleep scientists would say 8 hours is the healthiest. I shoot for 8 and I get 6.5, but I think it's the quality of sleep. I have a Oura ring that tells me how much time I spend in deep sleep, and I never get enough of that. And so I think that it's the quality of the sleep as much as the quantity.
Thank you so much. So can we all come in the front for a photograph? And thank you so much for this very interesting session.